Marijuana advocates are claiming mental disorders can be treated with the drug, but not everyone is convinced it really helps. Vanessa Rodriguez has more on the story. Vanessa?
Medical marijuana is being prescribed for almost every illness in the book, but marijuana advocates are now saying that people with mental disorders can use this drug instead of medications for disorders like depression or bipolar disorder. And as I found out, not everyone in the medical community thinks this is such a good idea.
Marijuana these days can be obtained for almost any health problems anyone may have. Among the list of treatable diagnoses are ADHD, bipolar, and depression. It is a huge controversy as to whether or not marijuana is actually helping or hurting people with these mental disorders. Studies showing that THC, the active ingredient in cannabis, disrupts attention, memory, and concentration, functions already compromised in people with the attention deficit disorder.
There have been a number of studies looking at the effect of cannabis on cognition, concentration, focus. The conclusion of those studies is mixed. There's no evidence it improves cognition, and there's some studies that say it actually makes it worse. And certainly long-term use, there's some early studies that show it actually shrinks the memory center of the brain, the hippocampus.
Marijuana advocates maintain that it is safer than Ritalin, the stimulant prescription drug most often used to treat ADHD. Nonetheless, expanding its use among young people is controversial even among doctors who authorize medical marijuana. According to the Centers for Disease Control and Prevention, patients and doctors have been reporting that marijuana helps alleviate some of the symptoms, particularly the anxiety and anger that so often accompany ADHD.
Weed helps me because it helps me focus and relax and when I'm studying or in class.
Researchers have linked the use of marijuana by adolescents to increased risk of psychosis and schizophrenia for people genetically predisposed to those illnesses. And at this time, there have been no studies that says marijuana helps people with mental disorders.
It's not going to improve the situation. It can, in some cases, make the depression much harder to treat if people are using marijuana. And it may actually make some antidepressants less effective. And there may be situations where people are actually depleting the very neurotransmitters we're trying to replace.
Weed is known for depressing people, and especially people with mental illnesses such as depression, bipolar, and ADHD. But until studies show marijuana hurts or helps mental disorders, people will continue to use it to self-medicate.
Despite skepticism among doctors about using weed for mental disorders, cannabis is still being prescribed for a wide variety of illnesses. And while many doctors say marijuana can help with things like back pain or a headache, people with mental disorders should probably stick to their prescription medication. For State of Events, I'm Vanessa Rodriguez.